Okay, today I'm going to go over an exercise that's for your gluteus medius. It's one of your hip abductors, or it's an exercise for your hip abductors in general. And those are muscles kind of along the side of your butt region. And what they do is they basically, when you contract your hip abductors, it takes your leg and it takes your leg out to the side away from your body. So that's what they do. They're used also a different way when you're in a standing position and you have your weight on your foot. Your hip abductors also have to work or contract when you're in this position also. So whenever you're going upstairs, walking, got your weight on that one foot, maybe doing a single leg squat, your hip abductors have to work to kind of keep everything in alignment. So if you don't have strong hip abductors, or if they're not working right or not working well, what happens is you can have what's called a hip drop. So what that is if I've got my weight on my foot and I don't have good hip abductors, then my hip will drop out to the side. So it'll look something like this. My hip all the way out to the side. And so that causes some problems. Obviously it kind of torques your back. So over the long run, and, with this happening a lot, you can start to develop back pain, you can get hip pain. And if you look at my knee starts to kind of angle inwards towards my body. So it takes your knee out of alignment too. So in the long run, it can cause knee pain also. So when you've got your weight on your foot, like when you're walking around, you don't want to be in this position. You want everything to be kind of right underneath each other. And that's a better position for your body to be in to kind of minimize those problems. So we're going to go over an exercise that kind of works with this. So basically, all I'm going to do is I'm going to stand on one foot, okay, and then I'm just going to let my hip basically drop out to the side. So I'm going to let it drop out to the side, and then I'm going to bring it all the way in so everything's in alignment. So I'm going to kind of like push through my foot to bring my hip in, pretend like I'm trying to lengthen my spine, grow as tall as I can, and as you can see me now, everything's kind of in alignment. Okay, my foot, my knee, and my hip are all in one straight line. Okay, so I'm going to hold this for maybe 20, 25, 30 seconds, long enough for you to feel the glute muscle contract. So while I'm here, now that I've been here for a good 15 seconds, I can really feel my glute work. So that's this area right here. So it's been about 15, 20 seconds. I'm gonna let it drop out to the side again, and then just kind of, again, push to my foot and bring my hip back in so that everything's in alignment. I'm gonna hold here for a good 15, 20 seconds, and I can really feel that gluteus muscle contract. Okay? So if you're able to do that, and that's pretty easy, then you can start adding resistance. So I've got a band here. I'm gonna wrap it around my shins. Okay, and same thing. I'm gonna stand on one foot. Okay, I'm gonna let my hip kind of just drop out to the side, and I'm gonna bring it all the way in. And then from there, I'm gonna take my other leg and just take it out to the side to use that resistance of that band. So now with that extra resistance in that band, that's gonna make my gluteus medius on this side, that's stabilizing my body, it's gonna make it work extra hard. It's gonna make my left side work too, this side work also, but it's actually making this side work harder. So once again, I'm gonna have my hip out to the side, I'm gonna bring it all the way in, and then use my other leg to exert force through the elastic band to make this glute muscle work even harder. Okay, thank you very much.